We have Dr. Paula Hardiman joining us, and she got here just in the nick of time, and we're so thankful. And we did not know there was this much construction here. So I know this is a topic that everyone's really excited to hear about, and I get questions. I know we all talk about this a lot in all of the groups, balancing movement and fatigue, exercise and energy preservation in NMOSD. Dr. Paula Hardiman, thank you.
Okay, good afternoon. So I've used all my energy of trying to literally get here. I was well aware of the construction and I knew the exit I needed was going to be detoured. What I didn't know is I practically had to exit the airport, come back around, and then figure out the maze to get here. Corey, to change the slides, do I? Is it this?
Yes.
Okay. All right, so we're going to talk about how to balance movement and fatigue and how to live your best life with NMOSD. So first of all, what is fatigue and NMOSD? It is a persistent tiredness that's not relieved by rest. It is usually due to the nerve injury in the brainstem or from the spinal cord. Sometimes because of those nerve injuries, patients can have problems with neuropathic pain or spasticity, which then causes different sleep issues. Medications that we can use to treat spasticity and neuropathic pain, a lot of the side effects from them, from the medications is drowsiness, or it can make people feel a little bit fatigued. And then also just being in pain. If you're hurting all day and your pain is not well controlled, that will just make you feel tired. And then the pain will also play into the mood, where if we all think about it, when we've had a flu or something, you just kind of hurt, you don't feel good, your mood's not good. Therefore, you're in this, what I call this negative feedback loop of just feeling fatigued all the time. And what people take for granted is it is okay to have fatigue from time to time. So it is very normal to have a day where your body just says, I need a rest today. That is completely normal. And give yourself that grace and that allowance to say, I just need to take a break today. Listen to your body. That is key. So there are different types of fatigue that my patients will describe to me. So one is just what I call the physical fatigue. Those are the ones who come in and says, well, Paula, no matter what I do, I just feel like my legs are heavy, my arms are heavy, like my full body is heavy. I just can't pick my body up. And then patients can come in and describe what I call the mental fatigue. No matter how much sleep or how much coffee I drink, I just feel like I can't focus, I can't concentrate. It takes everything in me to get my brain just to feel like it's working to comprehend information. And then, of course, when evaluating for fatigue, we want to look to see if there's other secondary causes that can be contributing, or the cause of the fatigue, whether it's due to sleep, mood, other blood conditions such as anemia, or if a person may have an infection. So when should you be concerned about your fatigue? So what I tell everyone, again, I emphasize it's normal to have fatigue from time to time. But if you feel like your fatigue is starting to interfere with your work or different daily living activities, at that point it is probably to bring it up and say, I have this fatigue that even getting dressed just takes all my energy from me. Is there something we can do about it? Anytime you have fatigue that's accompanying any type of new symptom, whether it's neuropathic pain or a muscle spasm or vision changes, at that point, please, 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 by all means, tell your healthcare provider. If you try to rest, so maybe let's say you went on a long hike and you were out running errands and you spent all day at Costco trying all the little samples of everything, and you're like, man, I'm tired, I probably need a rest, I probably overdid it, and you rest a day, 2 days, 3 days, and you still feel, yeah, I'm just not feeling, refreshed or anything. That could be a good time to bring up, like, when I do rest, I still just don't feel like I get rested. And then, of course, if you have any signs of a fever, infection, different things of that standpoint, that can also cause you to feel fatigue. Bring that up to your healthcare provider. So when I have a person who comes to me for the very first time with fatigue, before I say this is probably fatigue secondary to NMO, I want to ask them different questions, do an evaluation. Could there be something going on with the thyroid? Could there be some type of anemia, B12 deficiency? For women, as they're getting into being in their 40s and 50s, I start thinking about perimenopause, menopause issues. We'll encourage them to talk to their PCPs or the gynecologist to look at their hormones. Could they be a good candidate for hormone replacement therapy that can also help improve fatigue? So once I go through all of that and I feel like, well, you're not anemic, you're not menopausal, you're sleeping well for the most part, the patients always ask me, well, what should I do to improve my fatigue? And everybody hates this answer, but the best way to improve fatigue is just to move more. So when I say move, I do not mean to go out here and run 26.1 miles in 10 seconds or whatever. It's just, as it sounds, move. And so if you're not accustomed to moving, there's different ways that you can incorporate movement. So what does movement do? It gives you more energy, it helps with your mood, it'll actually help you sleep better and improve your strength and reduce stiffness and pain. So how can you incorporate this different type of movement? The one easiest thing that most of all of us have access to is just to go outside and walk. You don't have to think about trying to walk far. Just start small. If where my mom lives, she has a very long driveway. And so for some people, it may be my goal is today is to get out, walk down the driveway and back. That is perfectly fine. Remember, be gracious with yourself, meet yourself where you're at, and then start building onto it. So maybe the next time you go out, go down the walkway and go down to one house and come back. Again, the goal is to start moving. If you have access to a pool, whether if it's at home or in the gym, that is a great way to move and preserve energy, especially for those who are heat sensitive. So in Texas, and I can't believe it, here it is March 22nd, and it's going to be 94 degrees today. I would not encourage my patients to go out and walk when it's 94 degrees. But if they have a pool, you can do so many different activities in the pool. Even if it is just simply walking back and forth in the pool, you will get a great workout, a resistance workout, and it also helps to conserve some of your energy. Chair exercises, now with the invention of YouTube and COVID-19 has allowed for a lot of different YouTube channels to come on where there are people who will show you how to do chair exercises. And I will tell my patients, just go onto YouTube, search for chair exercises, and they will pop up, and they're varying lengths of time. So they can be 5 minutes all the way up to 30 minutes. Again, meet yourself where you're at. If you're just at the 5-minute mark, start at the 5-minute mark and slowly build up. Light resistance, stretching and yoga. I am a huge believer in stretching and yoga. When you have certain type of neurologic conditions such as NMO, SD, you're at a higher likelihood of just naturally having your muscles to feel really tight. And so when you're trying to move around with tight muscles, that causes you to expend more energy. So therefore, by the end of the day, you're going to feel more tired compared to someone like me. So the more you can incorporate just a little bit of stretching, doesn't have to be anything fancy. I'm not saying you gotta go spend a ton of money and join a yoga studio. 5 minutes in the morning and 5 minutes in the evening can make a huge difference. And I know what everybody's thinking here, but I'm so busy with work, kids, family. I don't have time to do this. And I agree, life can be challenging. So I would at least challenge everyone who feels that way to think of something that I learned from a different organization I've worked with called Can Do MS, is they have this idea called exercise snacks. And you're like, what does that mean? So what that means, if you're watching a television program that's an hour long, that television program is not really an hour long. On average, it's about 45 minutes. So there's 15 minutes worth of commercials that come in different intervals. So during the commercial, you can just start doing little things, whether it's just, I'm just gonna move my arms during the commercial. That's perfectly fine. If you're sitting on your sofa or your chair, just start marching. You don't have to do anything fancy, just start marching, just start doing some type of movement during those commercial breaks. And before you know it and you realize it, you just did 15 minutes of activity. So find 2 or 3 shows a week that you like and say during those commercials, I'm committed to do some type of moving during that time. So like I alluded that it's going to be extremely hot today. So remember, some patients, not all, but majority of patients are going to be a little bit heat sensitive. So even if you're inside, patients always argue this to me, but I'm inside in air conditioning. It doesn't matter. It's just the fact that it's hot outside that can impact you and you can have a little bit more fatigue. So be mindful of that. Try to use different things to help with the fatigue, whether it's cooling tools, hydration, Don't go outside at the high heat of the day. Cool showers, and of course, stay in the air conditioning as much as you can. So sleep and fatigue. I really think this is a big, big, big issue. And a lot of us, not just patients with NMO, but everybody takes sleep for granted. And everybody could probably do things to improve their sleep hygiene. So some of the elements of sleep hygiene include having a consistent sleep schedule. So that means 7 days a week, even if you don't have to get up and go to work, you still need to get up at 6 o'clock in the morning, and you should still make plans to go to bed at 9 o'clock at night. When you try to do this thing of Saturday morning, I'm going to sleep in to 10 a.m. and you're going to stay up later, you're going just to cause yourself to feel more fatigued when Monday, Tuesday comes around. So it's just best to keep a schedule. And I tell people, I get it. I don't want to get up at 5:30 on Saturday either. So I give myself a little bit of flexibility, but I am still getting up around 6:30 on Saturday mornings just to keep my body into the rhythm it's used to. Reduce your screens, and particularly as you start to get ready for bedtime. Everybody with kids, what do you do with your kids when it's time to get ready for bed? They have a bedtime routine, whether that's giving them a hot bath, telling them a story, you tell them to start turning off certain things. Well, as an adult, we need to do the same thing. So if bedtime is 10 o'clock, probably around 8, start turning the lights down, stop playing on the phone, stop scrolling, do certain things that are going to relax you, whether it's stretching, hot shower, meditating, reading, do whatever just starts to relax you and to tell the brain it's time to slow down, we're getting ready to go to bed. And then no TV and no scrolling in the bed. And so what I tell everybody, and I'll keep it semi-clean since there's a young person in here, the bed is for sleep and sex only. So no watching TV, no scrolling, no nothing. So if you're a type of person who likes to read before going to bed, have a chair that you can sit in your bedroom, and then as soon as you start to feel sleepy, get in the bed. If you get in the bed and you're like, I'm not sleepy anymore, don't lay in the bed awake, because you're training the brain to say this is appropriate to lay here and be awake. Get out of bed, go to your easy chair, whatever it may be, until you start to feel sleepy. If you wake up in the middle of the night, here's my second challenge for everyone. If you wake up in the middle of the night, do not look at the clock. I don't care whatever time you think it is. Don't look at the clock. You can lay there for a few minutes, take some slow, deep breaths. I promise you, you will fall back asleep. And I promise you, if you don't look at that clock, even if you wake up at 3 o'clock in the morning and you didn't go back till 5, just because of the fact you didn't look at that clock and watch that clock for every 5 minutes, say, oh my God, I'm still awake, I'm still awake, I'm still awake, you will feel more rested even not that you had that interruption in your sleep. Trust me, try it and you'll be like, she's right. I had to do it to myself. It is so easy to say, oh my gosh, I gotta get up in an hour. And what that does is it actually turns on the brain. You start activating your fight or flight, which is going to keep the brain up. So when you wake up in the middle of the night, don't look at the clock, do some other things, breathing, different things to help relax, activate parasympathetic nervous system so you can fall back asleep. Keep the room cool. We sleep best the colder it is. And so if I have written letters to for my patients to their energy company saying they have a chronic neurologic condition. They need to keep their home very cool. So please have grace on them with these high bills. I have, because it's important to me. Keep your room dark. Try not to have any caffeine late at night. So why does this matter? Because when you have poor sleep, of course, you're going to have more daytime fatigue. When you have more daytime fatigue, overall, you don't feel well. If you're working, it can cause performance issues at work. When we're all tired, think about it. When you've had really poor sleep or you tossed and turned, your mood is not great. You're cranky. That was me at work this week. I was very cranky, and I knew I was, and I didn't like that. And then heat and disrupted sleep can also cause worsening of your symptoms. So if you're having long periods of time where you're not sleeping well, you will start to notice like, oh my gosh, my legs feel weaker, or you're having more neuropathic pain and you're like, I wonder why. I'm doing all the things they told me to do. I'm taking my medications. I'm on this great drug to prevent relapses, but I feel like I'm getting worse. It could be due to poor sleep quality that's now causing fatigue. So I always get asked questions about, well, is there some type of diet I should follow? And so my PC answer for that is, I don't know. There's no studies or anything to say this is the specific diet that people need to follow when they have inflammatory conditions or neuromyelitis SD. But from my own self-observation, what I'll tell people, like, if you eat more fruits and vegetables, those are going to help you to feel a little bit more energetic. So I tell people, if you have to follow a diet, the one that has the most scientific information around it for just neurologic conditions as an umbrella term, is the Mediterranean diet. So lean meats, fish, nuts, avocado, those type, and of course, fresh fruits and vegetables. I know it's hard sometimes that we all live busy lives and you want to try to eat better, and it's just easy to go drive and talk to that box and get 5 burgers really quickly. Again, because of COVID, I think there are so many different meal delivery services that have come, and they're actually some of them have really, I've tried a few, some of them actually have really good food, and they're not that expensive. So maybe that might be something just to think about. Some of them will either come to you as already being frozen, or they'll give you instructions to say you can freeze it. So maybe an idea is, order up some already pre-made meals, shove them in the freezer, and if you know it's going to be a busy week, take out a few, pop them in the oven, and a nutritious dinner is made. Again, I've alluded to this with mood and fatigue. So if you're a person who has a very high stressful job and you're always on the go, 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 if you don't take a time to rest the body, rest the mind, that stress or that overwhelm that your work is causing, that can make you feel more fatigued. What goes kind of piggyback with that stress and overwhelm is anxiety. So usually people who are worried about different things, if they don't have a good way of managing their anxiety over time, they're going to start to complain about fatigue, as well as anxiety's best friend. Usually when people have anxiety, they have depression as well. Not always, but they usually do go hand in hand. So anyone who is feeling like they're having depressed mood, lack of motivation, lack of interest, could have some depression going on, and that could be the cause of your fatigue. There are different ways to help with these different mood disorders. Not everyone will need to be on some type of medication for their mood disorder. Sometimes just going to a therapist, a counselor, to give you different resources, whether it's learning how to meditate. There's different type of breathing exercises. There's a type called box breathing that they can teach you how to do. So you can have all these different type of tools in your toolbox, depending on what type of situation you're in, that can trigger that anxiety or that stress or that overwhelm, and you'll know to pull out that tool to help with that. And then fatigue is a personalized plan. So whatever I tell you is not going to be the same thing I'm going to tell this person, because they're going to have different issues. And so you want someone who's going to listen to when you have fatigue, what type of fatigue do you have, and help you develop that personalized plan. Some people will do better trying to exercise first thing in the morning. I've had some patients who will say, I can't. That just seems to zap all my energy. Understand completely. Let's talk about some different ideas and strategies that will help with you. So there's not a one size fit all, and don't let people make you feel there's a one size that fit all. But I am a good believer of getting your own data. So track your activity, track different things that you're doing. When I do this, how do I feel afterwards? If you don't feel good after, let's say, lifting weights or something, then don't do that. Maybe that's not the right activity for you. If you feel great after going for a bike ride, maybe that is more of an appropriate activity for you to do. Really pay attention to your sleep. And there's all these different types of wearables, like an Apple Watch, or there's this Oura Ring thing, which is kind of pricey. But there's different things that you can use to help give you some data on how well am I sleeping. And then what I always tell my patients, well, try and keep a diary of when do you feel like you have the worst fatigue, and think about what happened during that day. Is there an identifiable trigger that we can find? And then we can make a plan based on whatever that trigger is to help you manage your fatigue. And then on the reverse, keep track of things that make you feel refreshed, give you more energy, because that can also be things to incorporate into your individualized plan. So what I tell patients is to think about, when you have a neurologic conditions such as NMOSD, you do want to be mindful of your energy and you want to conserve where you can. So pace your tasks. It doesn't mean you have to try to complete all 10 things today. So prioritize. So what is absolutely has to be done today? So where I'll hear this all the time is usually from women who will complain, well, I have to cook dinner and then I have to wash the dishes. And I stop them at that wash the dishes point. I was like, do you have to? Do you have to wash those dishes tonight? Well, yeah. I was like, well, what happens if you don't? They'll be there tomorrow. Exactly. So sometimes it's okay to say, that's just going to be there tomorrow, and that's okay. I don't wash my dishes every night. I have learned to go to bed with dishes still in the sink, but it gives me a sense of peace, and I'm not going to push myself to continue doing something when my body says it's tired. Plan for rest. And this is true when working. So what I tell all my patients, no matter if you're working or not, think about taking small little breaks throughout the day. The brain just needs sometimes 10 to 15 minutes for it to rest, and therefore you will overall feel like you have rested as well. So plan rest activities. If you're at noon, you just really need to lay down for 30 minutes, but then by all means do it. Lay down for 30 minutes so you can have energy to go on for the rest of the day. If you have different type of walking difficulties, use different aids to help you. Those aids can help conserve energy so you can use your energy when it's really necessary. And then think about modifying your home. If there's certain step-ups in the home or different obstacles that cause you to have to use a lot of energy to get past it, think about doing different things to modify your home. There are ways with different insurance plans that you can get. I think they save you on the sales tax of doing or certain things with doing certain modifications. So look into that. And then don't deplete your battery. So if you're getting to the end of the day and you can tell you've used up about 80% of your energy, at that point it's best to stop. Because if you use everything, then is it worth it to take the 2-3 days to re-energize your battery? Or is it better to stop at that 80% and then you'll have a re-energized battery the next day and you can continue doing a little more? So the key takeaways that I hope everyone was able to take away. Fatigue is manageable, and everybody's plan is going to look a little bit different. Some people will have an identifiable medical condition that is the cause of their fatigue, and so you're able to treat that fatigue improves. Some people will truly have fatigue secondary to their NMOSD, and there may be a different type of medication they can go on it. Some people maybe have untreated depression, and that's what you need to do to treat their fatigue. So it is manageable. Identify the different causes, and just remember, wherever you can, try to do a little bit of moving. Think about those exercise snacks, and for those who aren't exercising, I really challenge you just to try it. Start with a 30-minute television program. That's at least 8 minutes of activity, and if you can do that twice a day, you just did 16 minutes. So think of those little different ways of building in activity and movement into your day, and you will notice your fatigue is getting a little bit better and easy to manage. All right, thank you.